Now, as I mentioned earlier, a Victorian source had said to me, a Victorian government source, that lockdown could be extended to Melbourne Metro as early as tomorrow. The Premier's office has subsequently been messaging me and said, look, our advice from the Chief Medical Officer, we follow their advice, and we don't have advice to that effect at this, at this point, is basically what they said. But where else does this go, Andrew?
Well, yeah, you can do it tomorrow or you can do it in 3 days. I mean, that's how it appears to me. There's a lot more community transmission clearly than is being detected, and we know how this thing takes off. Now, you've got 60, 70 cases a day, suddenly you have 100. Before you know it, you've got 150 and 200, and it's not people from overseas, as we saw in the March wave. This is a fair income wave, and there's every other state of Australia's petrified at the moment that someone's going to bring it up from Melbourne and start the shutdowns there, because the shutdowns are the worst thing for a society. So he just needs to ring-fence Melbourne, basically. That's what Daniel Andrews needs to do, and he needs to shut it down. And maybe if you shut it down for even just 2 or 3 weeks, it would make a difference. It's all trial and error here. But just doing a number of suburbs now and saying a month, that doesn't appear to be doing enough. Yeah, so the Premier Andrews' office told me the government's continually guided by the advice of the Chief Health Office, but has no advice to this effect. Yet, I think, is the caveat. But, I mean, what would you say as the New South Wales Deputy Premier?
Well, we keep talking about locking down the borders. I agree with Andrew. You ring-fence Melbourne, you lock down Melbourne. Look, sorry to say, but Victorians will have to suffer. The national economy can't pay the price for this. They'll have to pay the price. And I agree with you. Shut it down for 2-3 weeks, but lock down Melbourne. Get some level of control, because it's out of control. Because we thought, at 60 or 70, we say in New South Wales, as we lift restrictions, the message we haven't done well is that we've got to tell people that there's going to be a spike. But if you're getting 30 or 40, that's fine as you lift restrictions, because we've just quadrupled the ICU beds in hospital. We spent $2 billion on PPE and our health system. But going from 70 to 108 today, that is alarming.
But you might seek, the Berejiklian government, and you're the Deputy Premier, you might look to lock down that border?
Well, we prefer not to, because those borders and those border communities will suffer. But what I'm saying, I agree with Andrew, lock down Melbourne, and that's where the problem is.
Well, it's interesting that Scott Morrison was advocating shutdowns to
Let's go to Peta Credlin. Let's go to Peter. Sorry, Peter.
Yeah, let's come down here to Richard Miles and I in the COVID state of Victoria. First of all, you cannot lock down the centre of Melbourne. It's much easier to close down a state border. I don't know how you do it. This was Andrew's crazy idea when he started with those 36 suburbs a couple of days ago. When there's entry points to those suburbs, you can't have a paddy wagon and a booze bus at every single street going in and out of those postcodes. It's just not realistic. What they have done tonight, please understand what they've done tonight. They have police stationed on every single floor of high-rise housing commission estates. The manpower there is extraordinary. Those people will not be leaving to go to work. They will not be doing anything like going to shop. All of their food, and Daniel Andrews said that today, will be brought in what will be like a military exercise. This is not a spike. This is absolutely a second outbreak. This is the 18th day of double digits. We're now over 100. This is a really, really big deal, and it's going to escalate from here.